I'm doing my speech on labor and delivery. Labor and delivery nurses help women through the process of pregnancy. They care from antepartum through neonatal. They take care of the mother and baby during labor, and they check the mother's and baby's oxygen level, heart rate, and blood pressure. They assist with inducing labor and coach the mother throughout delivery. After the baby is born, they monitor and run tests on them, and nurses assist with all types of deliveries, for example, vaginal, C-section, stillborn, and even a breech baby. There are 3 different types of vaginal delivery. The first one is a spontaneous vaginal delivery, which a mother goes into labor without any medications or special instruments. The second one is an assisted vaginal delivery, which the mother requires special instruments to deliver the baby. The special instruments used are obstetric forceps, which is used to cradle and guide the fetal head while applying traction to expedite delivery. The other instrument used is a vacuum. It's a suction device that holds the head tightly and allows traction to be applied. This is the obstetric forceps, and this is the vacuum. The third and final one is a normal vaginal delivery. The baby has been born with or without meds and no special instruments. During this type of delivery, the nurse assists with epidurals, and in emergency situations can even deliver the baby. I got this information from Labor's second stage, providing nursing care from EBSCO, and vaginal delivery emergency assistant from CENOL. The other common delivery is a cesarean section. This takes place when a baby is delivered by an incision in the mother's abdomen and uterus. Most of the time, the mother plans to have it in advance. Sometimes they do an emergency C-section due to complications. The woman has to have a C-section if her firstborn was delivered that way. The doctor will schedule a C-section if the mother has had some other type of uterine surgery. Some problems that causes an emergency C-section is if the vagina stops dilating or if the baby stops moving down the birth canal. During a C-section, the nurse helps by handing instruments to the doctor. After the baby is born and is breathing and stable, they administer shots to the baby also. Some types of shots are vitamin K injections. Then they weigh and measure the baby after they have finished with the baby. They check on the mother. They make sure the uterus is hard and not bleeding too much. They help the mother breastfeed for the first time and even give them his or her first bath. So as you can see, labor and delivery nurses do so many amazing things. I'm now going to tell you how the nurses began. This is also a picture of a cesarean section, so what it would look like. Labor and delivery nurses began with midwives. During the Middle Ages, people thought midwives were incompetent for the medicine they practiced. Male surgeons fought the midwives, saying surgery was better for the mother and baby, and midwifery was outlawed. Finally, they began to practice again. In the 1930s and 1980s, big changes happened in midwifery. The American Board of Obstetrics and Gynecology came and tried to take over and the midwives, which caused a 41% increase of babies dying. The first labor and delivery unit was introduced in the 1980s. The physician that didn't want anything to do with labor and delivery started to come around because they would get a pay raise from Medicaid. The midwives discovered that many births happen around 37 to 40 weeks. The American Academy of Family Physicians did not like midwifery, so the North American Registry of Midwives started doing a test for them. They had to pass a test to be considered a nurse midwife, and that is how labor and delivery nurse began and what they do. I got this information from WordPress.com, so now I'm going to tell you how to become one. A person must take prerequisites, which consist of English Composition 1 and 2, Microbiology with Lab, Public Speaking, College Algebra, and Human Anatomy and Physiology 1 and 2 with Lab. After they finish those courses, they can apply to nursing school of their choice. I chose Southwest to get my degree. Then they have to take classes in their desired program and do clinicals in the hospital. Then when he or she finished nursing school, they will have to take the National Council License Exam, also known as the NCLEX. There are different degrees a person could get, for example, an associate's degree, which is a 2-year degree, then a bachelor's degree, which is a 4-year degree, and the last one is a licensed practical nurse, which is a 1-year degree. I got this information from interbody.com, and the other source I used was Spotlight on Labor Delivery Nursing from EBSCO. And this is a picture of them checking the baby's heart rate and their respirations. I hope y'all have learned something about labor delivery nursing. Thank you.